I once had a patient named David. He was 68 years old, a kind, gentle man who had always been confident in his relationship with his wife. One morning, he walked into my office, looking confused and uneasy. "Doctor," he said slowly, "everything still feels normal. I still experience pleasure, I still reach climax, but nothing comes out. There is no fluid. Does that mean I have lost my manhood?" That question made me pause for a moment, not because it was hard to answer, but because I understood the fear behind his eyes. At this age, even a small change in the body can make a man start doubting himself. But the truth is, what happened to David, and maybe to you, is not the end of masculinity. It is a biological signal, a subtle message from your body asking to be heard, not a sentence of loss. Many men over 60 experience the same thing. They still feel pleasure, still reach orgasm, but notice there is no semen. They get confused, worried, and often keep silent for years out of embarrassment. But in medicine, we have a simple term for this condition: dry ejaculation. And I want you to know this does not mean you have lost your ability or that your body is failing. In fact, it is an opportunity to understand how your body truly works and to take care of your health in a proactive way, instead of waiting until problems appear. In the next few minutes, I will help you decode this phenomenon step by step in a clear, scientific, and easy-to-understand way. We will explore why you still feel pleasure, but the fluid is missing. What are the most common underlying causes? And most importantly, how you can restore your confidence, your connection, and your joy in intimacy. If you are listening to this and recognize yourself in David's story, do not panic. You are not alone, and your body is still capable of healing. Think of this not as an ending, but as the beginning of a new chapter, a chance to understand yourself more deeply. I am Dr. Laura Bennett, and today we are going to uncover the truth behind dry ejaculation, so you can realize that a man's true strength does not lie in the amount of semen he produces, but in his ability to listen to and take control of his own body. Stay with me until the end of this video, because what you are about to hear may change the way you see yourself forever. Before we explore the causes, let us take a quick look at how a man's body normally works when everything functions as it should. Imagine a perfectly conducted orchestra, every instrument, every drum beat, every note working together in harmony. Your body does the same thing in the few seconds of climax. The testicles produce sperm. The seminal vesicles, two small sacs located right behind the bladder, produce most of the nourishing fluid that feeds those sperm cells. The prostate gland adds another protective layer that helps sperm survive. All of this combines inside the urethra, ready for what I like to call the final note of this biological symphony. When climax happens, the pelvic muscles contract rhythmically, pushing the semen outward. It is an incredibly precise reflex, a beautiful coordination between the nervous system, the glands, and the muscles. And just one small glitch in this system can change the entire process. Here is something fascinating. Climax and ejaculation are actually two different processes. Climax is the neurological feeling of pleasure created by the brain. Ejaculation is the physical action of pushing the semen outward through muscular contractions. Normally, these two things happen together, so we think they are one. But they can actually separate, meaning you can still experience pleasure, but the fluid may not appear. When that happens, many men are startled, believing they have lost their function. But the truth is, the nervous system behind the pleasure is still working perfectly fine. It is only the mechanical pathway, the plumbing, that has encountered a small disruption. That is the first key to stop worrying. No semen does not mean no pleasure. Feeling pleasure means your nerves are still doing their job. The problem lies somewhere else, and that is exactly what we are going to explore next. Why does semen disappear? What blocks the path? And how can we bring everything back to normal again? In the next part, I will explain the 3 most common DASA, causes of dry ejaculation, and how modern medicine can help correct each one, so you can understand your body better and reclaim the confidence you deserve. Now let us go deeper into the 3 most frequent reasons why a man over 60 can still feel climax but no longer see semen. The good news is that most of these situations can be treated or improved once you understand how your body works. 1. Mechanical cause retrograde ejaculation. Imagine there is a small valve inside your body located at the neck of your bladder. Its job is to close tightly during climax so that semen is pushed forward and out of the body. But when that valve does not close completely, the semen chooses the easier path. It flows backward into the bladder instead of going out. The man still feels full pleasure but sees no semen. Later, he might notice his urine looks cloudy or slightly foamy. That is because the semen has mixed with the urine. This condition is quite common among men who have had surgery on the prostate bladder or bladder neck, or who are taking medications for high blood pressure, depression, or long-term diabetes. A Harvard Health study in 2024 found that about 27% of men over 60 who had prostate surgery experienced retrograde ejaculation, but more than 90% still reported normal pleasure. So your body is not broken. The direction of the flow has simply changed. Diagnosis is easy. You can do a urine test right after climax. If sperm cells are found in the urine that confirms the condition, treatment often involves adjusting medications or helping the bladder muscles regain tone, and most men can fully enjoy intimacy again once they understand that this is a mechanical change, not a loss of vitality. 2. Blocked seminal ducts. When the path gets stuck, your seminal vesicles work like small factories that produce and store semen. When everything is normal, the fluid travels through thin ducts toward the urethra. But if one of these ducts becomes blocked, semen cannot pass through, leaving you with the feeling of climax but nothing coming out. Common causes include prostate or seminal vesicle infections in the past that left scars or fibrous tissue. Tiny stones that form inside the ducts, similar to kidney stones, small cysts, or congenital structures that narrow the passageway. I once had a patient named Michael, 63 years old, who came to me with dry ejaculation. He had never had surgery, no diabetes, and felt normal otherwise. After performing a transrectal ultrasound, we discovered one of his seminal ducts was completely blocked by a small stone. Once it was removed, everything returned to normal within 3 weeks. This kind of issue can only be identified through imaging. You cannot diagnose it on your own. But the good news is, it can usually be corrected through a quick, minimally invasive procedure without major surgery. It is important not to diagnose yourself because only ultrasound imaging or endoscopy can confirm whether there is a blockage. In most cases, doctors can correct it with a small, quick, and safe endoscopic procedure without any major surgery. 3. Hormonal cause. When testosterone levels drop, testosterone is not just the hormone of desire. It is the conductor that coordinates the entire male reproductive system. When testosterone levels decrease, the activity of the prostate gland and seminal vesicles also slows down, making semen thinner, smaller in volume, or disappear completely. What makes this tricky is that the decline often happens silently. You may begin to notice other signs: lower sexual desire or needing more time to recover after intimacy, less intense orgasms, fatigue, loss of muscle mass, feeling down, or losing motivation for daily life. A Mayo Clinic study in 2023 showed that testosterone replacement therapy not only improves bone density and muscle mass, but also restores prostate function and increases both semen quality and volume in men over 60. However, not everyone needs hormone therapy. The first step is to check your natural testosterone levels with a morning blood test, since testosterone is highest early in the day. After that, your doctor can guide you through natural ways to boost it, such as eating enough healthy fats from foods like eggs, fatty fish, and olive oil, getting quality sleep because testosterone is produced most efficiently during deep sleep, doing light resistance training 3 to 4 times per week, reducing stress since high cortisol levels suppress testosterone production. Whether the cause is mechanical, obstructive, or hormonal, the main message is this: this condition does not mean you have lost your manhood. It simply means that one part of your system needs attention or fine-tuning. And in most cases, when you take the right actions, your body responds remarkably well. Modern medical research from Harvard to Tokyo, from Mayo Clinic to Cleveland Clinic, all agrees. The ability for men over 60 to regain sexual and physiological health remains strong as long as they understand their bodies and make timely adjustments. So, if you are experiencing this condition, do not stay silent or hide it. Think of it as your body's gentle reminder to start taking deeper care of yourself. In the next part, I will talk about a side of this issue that medicine rarely addresses: the emotional impact. Because sometimes, what truly troubles a man is not the physical change itself, but the quiet sense of loss within. I will never forget the look in Daniel's eyes, a 71-year-old man who once told me, "Doctor, I know my body is still healthy. I still feel pleasure, but inside I feel empty. It is not because there is no semen, it is because I feel as if I have lost something that made me a man." That was the moment I realized that sometimes the real issue is not physical, it is emotional. For many men, ejaculation is more than a biological reflex. It represents vitality, strength, and pride. So when that changes, the sense of loss feels deeply real. Several of my patients have told me, "I avoid intimacy because I am afraid my wife will notice something is different. I feel like I am not as strong as I used to be." But when they finally understand the truth, when I explain that the ability to feel climax means their nervous system still works perfectly and that they are not weaker but simply experiencing a natural transition, their shoulders relax, their eyes regain their light. I often tell them, "You have not lost your manhood. You are simply learning how to master it in a new stage of life." This is one of the most important psychological turning points. Because in modern men's health, we know that belief itself is part of the treatment. When a man truly believes his body is still capable, his blood flow, hormones, and nerve function all recover better. Science calls this neuroplasticity through confidence, the way belief activates the brain and nerve pathways for recovery. So if you are watching this and feeling anxious, pause for a second, take a deep breath, and remember, you are not broken. You are not weak. You simply need to understand your body again. Think of it this way: even the most powerful car needs maintenance after many years, not because it is weak, but because it has worked hard and deserves care. Your body is the same. It has not betrayed you. It is asking you to listen and treat it with care. I have seen men in their 70s and even mid-70s regain their vitality and confidence just by balancing their hormones, doing light exercise, and most importantly, accepting themselves. Because true strength is not measured in milliliters of semen. It is measured in peace, connection, and the ability to love. If you have a partner, share this with them. Do not hide it. What touches a woman most is not perfection. It is when her partner is honest, trusting, and willing to face things together. When you understand, release fear, and take action, your body responds beautifully with renewed vitality, deeper connection, and confidence that feels reborn. And that is what I truly hope you will feel, not only in moments of intimacy, but in every breath and every step of your mature, fulfilled life. When I finish a consultation, many patients tell me, "Doctor, just talking to you made me feel lighter." And I always smile and say, what helps you heal is not only medicine, it is understanding and calm. Because the male body, especially after 60, still has an extraordinary capacity to recover as long as you do not ignore its signals. Here are the 4 things I want you to take away from this message. 1. Do not underestimate small changes. If you notice any difference in sensation or semen volume, see a doctor early. One simple test can reveal the cause and give you peace of mind. 2. Manage chronic conditions. Diabetes, high blood pressure, and long-term medication use can affect physical reflexes. Controlling these conditions means protecting your sexual health. 3. Maintain a lifestyle that supports natural testosterone. Get enough sleep, do regular resistance training, and eat foods rich in protein and healthy fats. Those are your most powerful forms of natural hormone therapy. 4. Talk, do not keep it to yourself. Share what you are feeling with your partner or your doctor. Silence only makes the fear grow. A sincere conversation can open doors to solutions you never imagined. And above all, remember this: manhood is not measured in milliliters of semen. It is measured in awareness, confidence, and the courage to face your body with honesty. Your body is not against you. It is whispering to you, listen to me. I am still here. I still can. Age does not take away your strength. Only silence does. So if this message has given you clarity and peace, share it with a friend, a brother, or a father. You might be giving them one of life's most valuable gifts, understanding and self-trust. If you found this video valuable, hit the like button and subscribe to Men Over 60 Vitality, where science meets strength after 60. And remember, age does not define you, your habits do. See you in the next episode. Stay strong, stay vital.